Hello, thank you for joining us for this video. I'm Dr. Mark Hickman, a licensed physician in the state of Texas for over 40 years, a practicing surgeon for over 35, and in the past 15 years I've had a keen interest in the microsurgical reversal of men's vasectomies. A word of caution, the topic we will be discussing is a topic designed for mature audiences. We will be discussing aspects of human sexuality, and many of these topics are not appropriate for younger audiences, so viewer discretion is advised. Are you a Catholic man who's had a vasectomy? You may want to keep watching because there are some interesting aspects of the Catholic faith as they relate to elective sterilization. What is a vasectomy? Well, a vasectomy is a minor surgical procedure that is usually performed in a doctor's office. 1 or 2 incisions are made in the scrotum, and a tube called the vas deferens is isolated. The vas deferens is a tube approximately 13 inches long that connects the testicles and epididymis, where sperm are generated, matured, and released, and conducts them to the prostate and seminal vesicles, which reside underneath the bladder and secrete fluids that, combined with the sperm, form the male ejaculate. During the conduct of the vasectomy, a portion of the vas deferens is excised, and the loose ends are secured with surgical clips made out of metal, or sometimes sutures, or just electrocautery. This results in a sterilization of the man in a very high rate. Failure rates of vasectomies are only 1 in 10,000. The vasectomists often tell patients that vasectomies are permanent and not reversible. We'll discuss this later. How many vasectomies are performed in the United States annually? It is estimated that there are 500,000 to 700,000 vasectomies performed in the United States each year, and some evidence to indicate there was increased numbers during the pandemic. How many men get vasectomies that regret having them done? Not very many studies have been performed on this, but the available data shows that soon after the vasectomy, 1 to 5% of men regret having the vasectomy. Over ensuing years, up to 5 to 10% of men consider having the vasectomy reversed. Well, why would they do this? And are there any adverse effects to vasectomies? Well, the physicians that perform vasectomies typically say there are no side effects to the procedure. However, this is a somewhat controversial subject. There is some evidence to indicate, particularly if vasectomies are performed before the age of 35, there may be an increased risk of prostate cancer, heart disease, certain types of arthritis, and dementia, with the mechanism being that of one of chronic inflammation in the system. However, these effects are very small, and the topic has not been completely resolved in the scientific literature. However, there are other side effects that are not described that we see in our practice. One of them is a type of depression that men suffer, a small number albeit, after vasectomy. These men routinely describe themselves as being in a fog, and when they go back to the physician that performed their vasectomy, they often say, "It's in your head, there's nothing wrong with you." But we've had some good results with reversing the vasectomies in these men. Some men also suffer from intractable pain after undergoing vasectomy, and the treatment of choice is to surgically reverse the vasectomy. Some men are found to have formed antibodies against their own sperm as a result of undergoing the vasectomy. And when it comes to trying to reestablish their natural fertility, there are some obstacles with regard to these anti-sperm antibodies. Every case is individual and must be considered as such. What is the Church's teaching concerning the elective sterilization of men by vasectomy? In the Catechism of the Catholic Church, in paragraph 2399, the direct sterilization of men by surgical, medical, or other means is expressly forbidden. Direct sterilization means a procedure that is solely intended for its primary purpose to result in the loss of fertility of the patient. This is a contradistinction to indirect sterilization, where a surgical procedure or other intervention is carried out to treat a disease in that patient. For instance, if a man had a prostate cancer and it was recommended his prostate be removed, this would indirectly cause him to be sterilized. But this is not a forbidden activity in the Church's teaching. Pope Paul VI, in his encyclical letter, Humanae Vitae, states, quote, "Equally to be condemned, as the magisterium of the Church has affirmed on many occasions, is the direct sterilization, whether of the man or of the woman, whether permanent or temporary." On a personal note, as I approach my 65th birthday, I recall during my entire life that we were warned that too many children were being born and that the world's population would explode and we would have no way to care for these people. It's an interesting fact that within the past year it's been documented that the world's population is actually decreasing. Even China, which is not known for its truthfulness, has admitted that its population is decreasing. Now, an important question for Catholic men. Does vasectomy constitute a grave sin? Well, if you did not know the answer to that question to this point, it did not. But now that you're in possession of knowledge where the Church's teaching does indicate it is a sin, then you are in a state of grave sin. Fortunately, we have a mechanism by which this can be reconciled. It is a call for you to seek your confessor and confess this sin so that you can be forgiven for it. The U.S. Council of Catholic Bishops recommends that if it is possible and the patient so desires, that a vasectomy can be reversed if it doesn't constitute a large financial burden or other stress to the family. But reversing a vasectomy is not required to be reconciled of the sin. Can vasectomies be reversed? Well, they absolutely can, and I've limited my practice entirely to that over the past 5 years. What are some of the reasons that men seek microsurgical vasectomy reversal? The vast majority are men who wish to become fathers again. When I began the practice 15 years ago, a typical demographic was an older man who had previously been married or widowed and now with a younger wife. I firmly believe that God writes in the hearts of men and women to become parents and cooperate with Him on creating new life. And this instinct, this feeling is very strong. Over on a more contemporary note, I've noticed most couples now are in their 30s, have been married, have had children, and for reasons that they regret, the man underwent vasectomy. But once again, that yearning in their heart to have more children pulls hard, and they come to have the vasectomy reversed in hopes of reestablishing their natural fertility. This gives me great hope for the future of our society when we hear so much of the culture of death. But I smile when I see these couples saying yes to life. Other reasons men come to have their vasectomies reversed are sometimes to address the adverse effects that occur in a minority of men who undergo vasectomy. Post-vasectomy pain syndrome occurs where men have intractable pain, and the treatment of choice is to reverse the vasectomy. Some men come because of this depression that some men feel that they experience. They describe it as a fog that seems to descend upon them after they've undergone the sterilization procedure. What is the success rate of microsurgical vasectomy reversal? Well, the area is not particularly well studied in the scientific literature, and quite frankly, the answer is different for every patient. First of all, success varies from patient to patient. Is the man trying to reestablish his natural fertility to have further children? They feel the need on a spiritual basis to correct a sinful mistake of the past? Are they having complications from the vasectomy that are addressed by reversing the vasectomy? And also a myriad of other conditions and factors such as age, use of tobacco, the age of the vasectomy, other medical conditions such as diabetes and heart disease, medications, even the use of testosterone replacement therapy, all are factors, and we consider each patient as an individual to advise them on the likelihood that there will be success from their vasectomy reversal procedure. In conclusion, I'd like to read from a quote published online by the United States Council of Catholic Bishops entitled, "Love, Sex, and Sterilization." But what if fertility isn't a problem in the first place? What if our capacity to conceive and bring forth new life from our marriages isn't some kind of cosmic liability, but a very real participation in the creative work of God Himself? That's how the Catholic Church sees human love. That's her view of marriage, the awe-inspiring, life-altering power to share in God's own creative capacity. What we shouldn't do is separate the life-giving aspect of sex from the love-making aspect. That's not how God designed us. We are made to give of ourselves completely through sex with our spouse. And holding back our fertility is holding back a part of our being. When we reject God's design for us, we not only reject His plan, which is always for our ultimate happiness with Him, we reject God Himself, who loves us more than we can possibly fathom. Thank you very much for joining us and watching this video. I want to take this opportunity to thank the Pilgrim Center of Hope for making this presentation possible. If you have questions about vasectomy reversal or the adverse effects of vasectomy, how it impacts your Catholic faith, please do not hesitate to reach out to us at www.micro-vas-reversals.com. A member of my staff or myself will be happy to discuss your specific situation. Pax Christi, may the peace of Christ be with you all.